Hello, this is Dr. Ross, and this video lecture is to familiarize you with some of the named nerves that we like to cover in this section of anatomy and physiology. I will also describe each plexus. I've talked about these briefly in another video lecture, but in this one I'm going to talk about each one individually. This lecture is for my class as well as Dr. Camp's Anatomy and Physiology 1. We're going to start with the cervical plexus. The cervical plexus is a plexus of the anterior rami of the first four cervical spinal nerves. They arise from C1 to C4, cervical 1 through 4, in the cervical segment of the neck, which is shown here. The first nerve I want to talk about, or name nerve from this segment, is the supraclavicular nerve. Now this nerve, and you can kind of see in this image, is going to branch into three cutaneous nerves that innervate the skin above and below the clavicle. You can see these three branches forming on this anatomy model. They're not huge, but you can kind of make them out there toward the end. The next nerve I want to talk about is the phrenic nerve. Now this is a mixed nerve. It's got both motory and sensory information. This nerve is shown here. I've got pink arrows pointing toward the phrenic nerve, and it comes down on either side of the vertebrae. This nerve is important for breathing because it provides motor control to the diaphragm. And this is also why patients who suffer spinal cord injuries below the neck are still able to breathe effectively. And that's because the innervation for that diaphragm comes up from pretty high on the spinal cord. It also contains sensory fibers, and they receive input from the central tendon of the diaphragm, as well as the mediastinal pleura, as well as some other sympathetic nerve fibers. Now, this is not actually part of the cervical plexus. I just want to point that out. Another interesting fact is that irritation of this phrenic nerve, or the tissues that supply it, can lead to the hiccup reflex. Now the next plexus I want to talk about is the brachial plexus. This is a network of nerves formed by the anterior rami of the lower four cervical nerves and the first thoracic nerve. So C5, 6, 7, 8, and T1. It's going to supply both afferent and efferent nerve fibers to the chest, shoulder, arm, forearm, and hand. The first named nerve I'd like to talk about that comes from the brachial plexus is the suprascapular nerve. This is responsible for the innervation of the two muscles that originate from the scapula, namely the supraspinatus and infraspinatus muscle. This nerve also has sensory information about the acromioclavicular joint, as well as the glenohumeral joint. The axillary nerve, this supplies muscles in the arm, specifically the long head of the deltoid, specifically the deltoid and the long head of the triceps, as well as the teres minor. Recall that's one of the rotator cuff muscles. It carries sensory information from the shoulder joint, as well as the skin covering the inferior region of the deltoid muscle. Next, we have the musculocutaneous nerve. This courses through the anterior part of the arm and terminates a little bit above the elbow as the lateral cutaneous nerve of the forearm. In its course through the arm, it innervates the coracobrachialis, the biceps brachii, and the greater part of the brachialis. And then that lateral cutaneous part supplies sensation of the lateral side of the forearm from the elbow to the wrist. Continuing on with named nerves that emanate from the brachial plexus, we have the radial nerve. The radial nerve and its branches provide motor innervation to the dorsal arm muscle, so the triceps brachii and the anconeus, as well as those extrinsic extensors of the wrist and hand. It's going to have cutaneous sensory innervation to most of the back of the hand, except for the back of the little finger and adjacent half of the ring finger. The median nerve is going to go through the anterior part of the arm, forearm, and hand, and it's going to terminate by supplying the muscles of the hand. So it's going to innervate pronators and flexors of the wrist, digits, and thumb. It provides sensory information for most of the palmar aspect, as well as the dorsal tips of the thumb, the index finger, the middle finger, and half the ring finger. And so an interesting tidbit here is that carpal tunnel, which I think a lot of people have heard of, is actually a disability that results from this nerve, the median nerve, being pinched or pressed. Last on this slide is the ulnar nerve. The ulnar nerve runs near the ulna bone. That should not be surprising. This nerve innervates the flexor carpi ulnaris, and the flexor digitorum profundus of the forearm, as well as the flexor pollicis brevis, adductor pollicis, and palmaris brevis of the hand. It's going to provide sensory information from the remaining fingers that were not covered by the median nerve, for example, the fifth digit and half the fourth digit, as well as the corresponding part of the palm. It also supplies cutaneous innervation, or sensory information in that case, to the anterior skin and nails. Moving on to the lumbar plexus. The lumbar plexus is formed by the anterior rami of L1 through L4, so the lumbars 1 through 4, as well as the thoracic region T12. It's going to supply skin and musculature of the lower limb. All right, so we're going to start with the iliohypogastric nerve. This originates from the lumbar plexus, of course. It innervates the internal as well as the transverse abdominal muscles. It provides sensory information from the skin over the lateral gluteal region and above the pubis. The lateral femoral cutaneous nerve, this is a sensory nerve only. This is going to ultimately divide into branches, which are distributed to the skin of the anterior and lateral parts of the thigh as far as the knee. And it will provide sensory information there. The femoral nerve is the major nerve supplying the anterior compartment of the thigh. It's the largest branch of the lumbar plexus, and it innervates those anterior thigh muscles. So the quadriceps femoris group, that's going to be the iliopsoas, in addition to the iliopsoas, the sartorius, pectineus. And it's going to provide sensory information from the anterior thigh, the medial side of the leg, and the medial aspect of the foot. So that's that inner area. Next is the obturator nerve. This is responsible for sensory innervation of the skin on the medial aspect of the thigh, which isn't surprising considering where it terminates. The nerve is also responsible for motor innervation of the adductor muscles of the lower limb, so that's going to be the external obturator, adductor longus, adductor brevis, adductor magnus, and the gracilis, as well as the pectineus. All right, the last nerve in this section is the saphenous nerve. This is just a sensory nerve. It's the sensory branch of the femoral nerve that supplies sensation to the anteromedial, medial, and posteromedial surface of the leg. The saphenous nerve is the largest terminal cutaneous branch of the femoral nerve. Next, let's move on to the sacral plexus. So this is going to be a nerve plexus which provides motor and sensory nerves for the posterior thigh, most of the lower leg and foot, and part of the pelvis. It's formed from the anterior rami that emerge from L4, lumbar 4, through sacral 4. And so now let's look at some of the named nerves that emanate from there. So we're going to start with the sciatic nerve. The sciatic nerve is a large nerve that runs alongside the hip joint and down the lower limb. It's the longest and widest single nerve in the human body, so it goes from the top of the leg to the foot on the posterior aspect. And it's composed of the tibial and common fibular divisions. Basically, these two nerves are wrapped in a common sheath, and that is your sciatic nerve. When the sciatic nerve reaches the apex of the popliteal fossa, you can kind of make up that area in this image. It bifurcates into that tibial and common fibular nerve. So what I'm going to do now is talk about the common fibular nerve. So there's the tibial and there's the common fibular nerve that are branching off that sciatic nerve. All right. So the common fibular nerve, which I've already discussed, innervates the short head of the biceps femoris muscle. That's part of that hamstring muscle, which causes flexion at the knee. And then it further branches, the fibular nerve, common fibular nerve, will further branch into the superficial fibular nerve and the deep fibular nerve. The superficial fibular nerve in this image is that kind of blue area coming off there to the lateral part of the leg. The deep fibular nerve is not that red area, that's actually the tibial artery. The deep fibular nerve is that green nerve running down the front of the leg. So let's start by discussing the superficial fibular nerve. It innervates the muscles of the lateral compartment of the leg, including the fibularis longus and brevis. And basically, if you recall, these muscles act to evert the foot. And it provides innervation of the skin of the anterolateral leg and the dorsum of the foot, except the skin between the first and second toes. Now, the deep fibular nerve innervates the muscle of the anterior compartment of the leg. That's going to be the tibialis anterior, extensor digitorum longus, and extensor hallucis longus. These muscles act to dorsiflex the foot, as well as extend the digits. They also, this nerve also innervates some additional muscles in the foot I'm not going to discuss here. The sensory function is going to be to innervate the skin between the first and second toes, so that area that was not, the sensory information that was not provided by the superficial fibular nerve. Before I move on, and I should have brought this up earlier, you can see below the superficial fibular nerve, that box I have around it, there is another label for a blue area of the nerve just below, the cutaneous branch of the superficial fibular nerve. And that is going to be the part of the superficial fibular nerve that actually innervates the skin of the lower leg than the dorsum of the foot. Again, with the exception of the skin between the first and second toe. So that superficial fibular nerve will actually will provide the sensory information. All right, so let's get back to the tibial nerve. Recall the tibial nerve is a branch of the sciatic nerve. It continues its course down the leg, posterior to the tibia. During its descent, it's going to supply the deep muscles. It's basically going to innervate all the muscles in the posterior compartment of the leg. You've got the popliteus, the flexor hallucis longus, flexor digitorum longus, the plantaris, and the soleus gastrocnemius. The soleus and gastrocnemius, excuse me. The sensory nerve is going to innervate the skin of the posterolateral side of the leg, as well as the lateral side of the foot. The tibial nerve also supplies the sole of the foot, all the nerve sensation from the sole of the foot. Moving down, you have the sural nerve. The tibial nerve gives rise to a branch that contributes to the sural nerve, and this is a sensory nerve only. It innervates the posterolateral aspect of the leg, the lateral part of the foot, and the lower ankle. And then here we have the last nerve, the pudendal nerve. This provides it's a mixed nerve. It's going to provide innervation of the muscles of the perineum, the external anal sphincter, and the external urethral sphincter. So these are the sphincters we have control over. And then it's also going to provide sensory information from the skin on the external genitalia. And that is it for this presentation on the different named nerves as well as each plexus. Thank you.